what I'm going to speak about today has been kind of coordinated by the Global Adolescent Nutrition Network and involves a number of different co-authors who are listed here. Next slide, please. So I'm going to be talking about antenatal care for pregnant adolescent girls, and if we should be doing anything differently or anything special or anything youth-friendly, kind of above and beyond what other women get for their antenatal care. So in terms of background, despite the heightened nutritional needs of adolescent girls, they often receive the poorest diets within the household. They eat less, they eat last, and they can also be excluded from school-based health programs because they've dropped out because of socioeconomic pressures, early pregnancy, or cultural norms. And whilst progress has been made in lowering the fertility rates worldwide, it's estimated that 21 million adolescents between the ages of 15 and 19 years in low and middle income countries become pregnant every year, of which 12 million give birth. So we do have to focus on preventing adolescent pregnancies, but there's always going to be those that slip through the net. And right now we have quite a large number of those that need support. So pregnant adolescents are at higher risk of adverse birth outcomes. So that's for the baby, like stillbirth, preterm birth, low birth weight, as well as risks for the mum, so higher maternal morbidity and mortality rates compared to adult pregnancies, which is defined as 20 to 40 years. The reason that adolescents are more vulnerable to these birth complications isn't totally clear, but we know it is nested in biological and social and economic factors. Next slide, please. So I'm sure many of you know that the WHO released new guidelines for antenatal care in 2016. They recommend 8 antenatal care visits for pregnant women generally, and that's specific to adolescents, beginning at 12 weeks up to 40 weeks. And they state that that is in order to maintain a healthy pregnancy for the mum and the baby, to facilitate an effective transition to labour and birth, and also to achieve a positive motherhood. And during the antenatal care visits, essential services are provided, such as health education, maternal and fetal assessments, nutrition interventions, disease prevention and management. Adolescents often face cultural and financial barriers to accessing antenatal care, resulting in missed opportunities for them to receive these services. And some of the barriers that you see reported in the literature are the cost of transport, the distance to health facilities, as well as shame, blame, and stigma surrounding being a pregnant adolescent, sometimes out of marriage. There's limited evidence on whether adolescents require specific tailored antenatal care services and which specific services they are. And whether the adjustments would effectively reduce the heightened risk of maternal and neonatal morbidity and mortality that is associated with adolescent pregnancies. So we conducted a systematic review which aimed to evaluate whether tailored antenatal care services to pregnant adolescents would contribute to reducing adverse maternal and child outcomes. Next slide, please. So we had 2 reviewers independently search 5 electronic databases. That was last year. And then we also did a survey through the Global Adolescent Nutrition Network. So the search terms that we were interested in for the systematic review was adolescent girls 10 to 19 years. We also considered adolescents up to 24 years because the Lancet series does use that definition. The intervention had to be some kind of tailored antenatal care service. There didn't need to be any comparison in it, and the outcomes of interest were related to maternal and infant birth outcomes, the usual suspects. And across any setting, so low income, middle income, high income, because the evidence was pretty limited, and any study design. Next slide, please. So in the systematic literature review, we reviewed 11,000 articles, and we found 14 that were relevant for inclusion. And then, as I said, we did a stakeholder survey among the Global Adolescent Nutrition Network. We had 103 respondents. And in those, we asked for kind of examples from their country of any programs that provided tailored antenatal care and what they thought should be provided. And we asked whether they thought they needed to be specific, like additional antenatal care for adolescents, or whether it just needed to be standard antenatal care, but delivered in a youth-friendly manner. And almost 60% responded that they think it is both. It needs to be both additional support and also delivered in a youth-friendly manner. Next slide, please. So using the results from both the literature review, the 14 studies, is it 14? Yeah, 14, and the survey, we found different examples of ways that we could tailor antenatal care. So these points were on youth-friendly delivery. So there was points in the evidence and in the survey about flexible service delivery locations, so youth-only times at clinics, or increased privacy for accessing services because of the stigma. Lots of adolescent girls don't present to antenatal care until very late in their pregnancy when they're like really showing. Provision of money for travel to clinics, home visit programs, or community-based services. And specialised youth-friendly midwives were also used in a number of settings, largely in high-income settings. These are special midwives that have been trained in antenatal care for delivery for adolescents, and they've had special training in confidentiality and non-judgmental support. And there was also examples of group delivery, so including facilitation of peer support, so delivery to a group of young people. Next slide, please. There's, I don't know if you can hear, sorry, there's like someone driving past with a loudspeaker, but additional support for these results describe the additional support above and beyond standard antenatal care. So not just youth-friendly delivery of normal services, but additional support. So examples from the literature and the survey were tailored or additional nutritional support. So extra calcium supplements. There was kind of routine or additional iron supplements. Provision of supplementary feeding for those in food insecure context, if they're an adolescent mum, tailored nutritional care, so doing more of an investigation into their needs and then meeting those needs, and just screening for malnutrition, which may not be happening as standard practice. And then additional psychosocial support was also came up several times, so including health behaviour screening and advice, and additional mental health support and counselling. This especially came up in the survey that they felt that mental health of pregnant adolescents was especially poor. Then there's tailored and additional counselling and nutrition education. So more things around more extensive nutrition counselling, more practical nutrition sessions, age-specific counselling. So it should be tailored towards providing more knowledge, providing more focus on sexual and reproductive health, compliance of actually attending sessions, preventing the next pregnancy happening too soon, etc. And then there was also the point of additional partner and family engagement, because adolescent girls tend to not be independent, that family members and or partners should be more included in antenatal care and in the nutrition education sessions, because the adolescent girls may not have that much control over what they're eating. Next slide, please. And then there was the point about involving schools in antenatal care. So schools can be a really good platform, and it can also be a way of keeping pregnant adolescents in schools. Next slide, please. And there was also the point about additional postnatal support, although that wasn't the focus of our research. We were focusing on antenatal care. Of course, I think adolescent girls could really benefit from greater follow-ups, links to more resources, livelihoods projects, and breastfeeding support. Next slide, please. So the survey data identified key elements of tailored antenatal care that stakeholders felt were important, and these were supported by positive intervention outcomes in the literature. So in the few studies that we found, in the 12 studies, most had a positive impact. The interventions tended to be quite multifaceted, so providing a mixture of youth-friendly delivery and also additional services, and they had positive impacts on birth outcomes. I think slightly over half of them were from high-income settings, lots from America. So both youth-friendly delivery and additional tailored support seem to be important. We believe that a future study should consider testing a package of antenatal care interventions for pregnant adolescents that includes both these elements, the youth-friendly and the additional, and should explore combinations of these: practical nutrition education, tailored mental health support, nutrition supplementation, and greater involvement in family members in low middle income countries. So 12 studies is really not enough. And that, of course, preventing adolescent pregnancies is really important, as I stressed at the beginning, but we also need to support the many millions who fall through the net, especially at the younger end of the spectrum. So if you're 19, 20, that biologically that might be okay for you, whereas if you're 15, 16, they may need even more support. Next slide, please. Is that the end of the slide? Oh, there we go. And that's just a bit about the Global Adolescent Nutrition Network. It's a network at ENN that is free to anyone to join who's interested in adolescent nutrition. We do quarterly newsletters and quarterly webinars. So if you want to receive invites and newsletters, please feel free to sign up. Thank you.